Hello, everyone, and welcome to our Alliance for Retired Americans Town Hall with our special guest who will give us her insights, Acting Social Security Commissioner Kilolo Kijakazi. I'm Rich Fiesta, Executive Director Alliance, and we'll be joined by our President, Robert Roach, and the Acting Commissioner in a few minutes, a few seconds, actually. We celebrate every year, as you know, Older Americans Month, which is May. And in fact, this year is the 60th anniversary of Older Americans Month that President Kennedy first noted in a 1963 executive proclamation, which was then made into law in the 1965 Older Americans Act. So every year at the Alliance, we celebrate Older Americans Month, talk about the great programs available to older Americans that have been made available in those last 60 years, none of which is more important than Social Security, which is the subject of our town hall today. From 1935 to present, Social Security has been an important part of our daily lives, not only for retirees, but for families who may have lost a worker or a child who may have lost a parent, that it has been there through thick and thin and good times and bad, provided needed benefits and needed comfort for Social Security and its benefits for all Americans. So today we're going to focus on Social Security with the Acting Commissioner. But before we get started, we'd like to do a little poll. And we have a first poll question that'll come up on the screen. Have you ever visited your local Social Security office or have had to go to it during your life, either as a worker or a retiree or shortly before retirement? If you have, please click yes and then submit. No, obviously, same, no, and submit. We'll leave that up for a few seconds while I'm doing the welcome to all of you, and we're getting more people on the line. As I mentioned today, we're having a national town hall with our members and friends throughout the country. Social Security, unfortunately, too, has been in the news recently as Congress debates debt ceiling issues and whether or not to raise it. And Social Security and the ability to process benefits has been swept up in this much larger issue of debt ceiling as well. So hopefully, this will not come to pass, that people will be able to receive their benefits in a timely manner as all. So if you haven't responded to the question, please do so now. And what I'm going to do as we do that is it'll come off the screen and I'm going to introduce our Alliance President, Robert Roach. As you know, Robert has been our president since 2015. He previously was the International Secretary Treasurer of the International Association to Machinists. He's been very involved his entire career in retirement and retirement security, and is the leader of our annual Retirement Security Symposium we have here on the Alliance, which will be upcoming on October 17th. So, Robert, take it away.
Thank you, Rich. Good afternoon. I'm Robert Roach Jr., President of the Alliance for Retired Americans. Thank you all for joining our important Older Americans Month Town Hall. I know that most of you are here because we want to make sure that the Social Security benefits that we work so hard for, that we continue to get them and they arrive on time without complications. Alliance members make their voices heard on Capitol Hill to help get SSA the resources their employees need to do the essential jobs. We are fortunate today to have with us Dr. Kilolo Kijakazi. Hopefully I didn't mess that up, Doctor, but I did the best I could. Acting Commissioner of Social Security Administration with us. The Acting Commission has conducted research on and written extensively about retirement policy and economic security, which is clearly the focus of the Alliance. Prior to joining SSA, she was an institute fellow at the Urban Institute. She developed partnerships to expand and strengthen Urban Institute research agenda and share findings with diverse audiences. Before joining Urban, Dr. Kijakazi was a program officer at the Ford Foundation, where she focused on building economic security in communities where it is most needed. Dr. Kijakazi also holds a master's of social work from Howard University and a PhD in public policy from George Washington University. Welcome, Acting Commissioner. We are delighted to have you with us today.
Thank you, Rich, and thank you, Robert. And just to help out everybody, it's Kilolo Kijakazi. It's easier when you say it slowly.
Okay.
And I am delighted to join today's town hall in honor of Older Americans Month. I appreciate the opportunity to speak with your members directly. To quote President Biden's Older Americans Month proclamation, we have a responsibility to ensure our nation's seniors can age with dignity and financial security. This month and beyond, we celebrate older adults for their contributions. We support their independence and we recognize their unparalleled value to our nation. As Robert mentioned, before I joined SSA, I spent my career researching and supporting ways to enhance the financial well-being of people with low incomes, especially people of color, women, and people with disabilities. And I have worked for over a quarter of a century to strengthen the Social Security program. It's an important source of income for most workers and their families, but absolutely vital for people with low incomes. As acting commissioner, I'm honored to work with and support the work of so many dedicated and talented public servants. When I visit our field offices and our hearings offices across the country, I am so proud of our employees' dedicated and compassionate customer service. Before Social Security was established, life for older Americans was even more precarious. Thanks to Social Security, millions of retirees have been protected from poverty in old age. Most of the 66 million beneficiaries are over 65 years old, but nearly 14 million beneficiaries are younger than 65, including almost 8 million people who are receiving Social Security disability benefits and nearly 4 million children who are receiving benefits from disabled, deceased, or retired workers. Not only is Social Security a foundation of retirement security, it's also a pledge to today's workers and future generations. During and after a career of hard work, Social Security's guaranteed lifetime benefits provide you and your family members with a measure of protection. Year after year, we serve millions of people because of the unwavering commitment of our employees. Last year, we completed about 10 million claims for benefits. We issued about 16 million new or replacement Social Security cards. We helped nearly 13 million visitors to our field offices and answered about 69 million phone calls. Unfortunately, our hiring over the past decade has been limited due to insufficient and untimely funding. This year, we're beginning to rebound from our lowest staffing level in 25 years. Our service in some areas, particularly disability claims, is not where we want it to be, largely because we haven't had enough staff. We now have over 1 million people waiting for an answer on their initial disability claim. We are working assiduously to reduce this backlog because people are counting on us to help them make ends meet. I have assembled a special team to develop and implement solutions. Their work is well underway, and this team has employed analytics to identify bottlenecks in the disability determination process and factors contributing to them. For states with some of the largest backlogs, we have established a cadre of adjudicators and reviewers to assist with initial claims and reconsiderations. We also now have a cadre of senior disability attorneys from the Office of Hearings Operations who are conducting disability hearings in the state disability determination services to free up experienced state disability examiners to work on initial claims. To facilitate more efficient collection of medical evidence, We are establishing a national contract with medical and psychological consultants, and we issued guidance permitting telehealth for certain consultative examinations. We are urging states to staff up their DDSs, or disability determination services, as quickly as possible. And we are working with the Office of Personnel Management to make it easier to onboard and train new SSA and DDS hires. In addition, my executive team and I are visiting with state DDSs and learning firsthand about the issues they are facing and working with them on proposed solutions. We appreciate the significant increase Congress provided for our operating budget this fiscal year, but it is still only 55% of the increase the president requested. Most of the funding increase we receive covers fixed costs like salaries, rent, and security. After covering these fixed costs, we're using the remaining funding to recruit, hire, and train thousands of new staff. To build on the progress we're making this year, we will need the president's full budget request of $15.5 billion for next fiscal year. Improving service comes down to three core areas: people, technology, and process. Hiring for our frontline positions means we will have more staff to process claims. As our new hires become proficient, we will begin to reduce the average time a person has to wait for a benefit decision. Even for benefit applications filed online, we need enough employees to process those applications. We also need enough knowledgeable staff to answer questions for people calling our 800 number or local offices. Service at SSA is a balance between skilled staff and modern technology. Upgraded systems improve self-service options for people who prefer to interact with us online and have the ability to timely reach us by phone. Also, the rebuild of our workforce, along with the rebuilding of our workforce, our IT investments make us more efficient and help us reduce the wait for an appointment and wait times in our offices. In April of 2022, we were able to successfully reopen our offices to walk-in visitors, in part because of our IT developments. We use predictive analytics to identify offices that had the potential for experiencing high demand, and we recruited volunteers from across the agency, as well as retirees from SSA, to assist these offices in serving our customers. Volunteers, along with managers, used our IT developments to conduct triage with customers awaiting entrance to our field offices. They showed customers how they could go online to receive services if they did not want to wait. They informed customers who had other places to wait, such as in their vehicles, that they could be alerted via text messages when it was their turn. All of these actions allowed us to bring people who could not wait outside our offices, such as the elderly or people with disabilities, inside right away. As another part of our IT development, we are transitioning our national 800 number to a modern platform this fiscal year. This transition was interrupted by the pandemic, but we expect to complete it this year. The new system should provide more self-service opportunities for the public, as well as an estimated wait time and callback option. With more staff and IT modernization, we are hoping to reduce wait times by next year. Again, let me share how our employees are going above and beyond, even as they face daunting workloads. One customer recently told us, my wait time for a human response was too long, about 35 minutes. Sorry, my screen went blank for a minute. But the agent who helped me was wonderful. She was cheerful, kind, and understanding, very attentive to detail. And I had a similar experience to this customer. Some years ago, I was assisting a family member who moved from one state to another and needed to know what to do about their Medicare Part D. I called the number for customer service, only to find out later it was SSA, and the employee was incredibly patient and kind, and she walked me through the process. This stays with me because I was so concerned about making a mistake that might put my family member in a bad place. And so this reassurance from the customer service representative was everything to me at that time. Last week was Public Service Recognition Week, but no matter what week it is, I must recognize our hardworking employees who are striving to provide efficient and compassionate service in the face of increasing workloads. We want to meet people where they are. So if you want to do business on the computer, we're there. On the phone, we're there. In person, we're there, especially for individuals who do not have access to digital services or need in-person service. We have over 75 million My Social Security accounts now, nearly 30 million more than we had pre-pandemic. And don't think that online service is just for young people. Roughly 59% of all accounts are people 50 years old and older. If you haven't created your My Social Security account, I encourage you to go online at ssa.gov and sign up. People can use their personalized accounts to check their benefit statement and earnings records before filing an application for retirement or other benefits. People can use it to get their benefit verification letter or request a replacement Social Security number card. It is important to note that for most actions, you do not need a Social Security card. You only need to know your number. However, for people who do need a replacement card, we are expanding and advertising our online service to apply for a replacement card, which is one of the most frequent needs driving people to visit a field office. This online service allows us to free up our staff for other critical in-person needs. Finally, we're streamlining our business process, particularly in the very complex disability area. For example, reducing the disability backlog requires implementing solutions and new processes in several areas, including collecting medical evidence electronically from healthcare providers. This reduces the burden on applicants and speeds up the review and determination process. Overall, the less complex we can make our policies, the easier they are to administer and for the public to understand. We welcome your feedback as we continue to improve our services. We have an outstanding workforce, but we must have sustained and sufficient funding if we are to deliver the service the public deserves and expects. If Congress approves President Biden's $15.5 billion request for FY 2024, we will be able to deliver the service improvements we want to make. A funding level less than that will require us to make difficult trade-offs that will affect our service to the public. We are currently hiring across the agency. If you know someone who would excel at serving others and would like to take advantage of the many benefits federal employees enjoy, please tell them SSA is hiring. Social Security protects Americans of all ages throughout life's journey today and in the future. And we're eager and ready to welcome a new generation of public servants. Thank you and happy Older Americans Month.
Well, thank you, Acting Commissioner, for being with us and giving us really good up-to-date information. Want to tell our participants, if you have any questions for the commissioner or us after she needs to leave from us, please use the Q&A symbol down at the bottom of your screen. It'll be a pop-up. A number of you have already, and we can get to your questions as time permits there. In fact, I have a question based on what the acting commissioner told us and what's going on in the world now. As you know, the U.S. House of Representatives passed a bill with 22% cuts across the board to spending, which would include the Social Security Administration. And we at the Alliance know that funding from the Social Security Administration comes out of the Social Security Trust Fund, which is our money as workers and our employers' money too. So there's no other money in there from general revenues. But nonetheless, Congress must every year appropriate money from it to run SSA. But now, since the House has passed a 22% cut across the board, which would include the Social Security Administration, what, Acting Commissioner, do you see would be the impact on beneficiaries and applicants at Social Security?
In general, funding cuts of this magnitude would dramatically undermine our ability to serve the public. For example, we may need to stop hiring, furlough staff for weeks, and possibly lay off employees, producing even longer wait times than customers experience today. We may need to reduce the availability of our local offices, cutting off vital access to face-to-face service delivery, and drastically cut IT at a time when we need it to help mitigate other cuts like office hour reductions, a hiring freeze, and layoffs. If the proposed legislation were enacted, it would be devastating for our agency and the millions of people we serve every month.
Thank you. That's why we at the Alliance need to be active, and we'll tell you how to do so after the commissioner leaves us, on the importance of stopping 22% cuts, but also increasing resources for SSA to do its job on behalf of over 60 million Americans. We have a number of questions. Some of you have asked the same questions, so I'm going to consolidate them. Oftentimes there's a lot of just confusion about Social Security in the public, oftentimes a lack of awareness for the very different types of benefits and how staff, frontline staff in particular at Social Security, can help applicants and beneficiaries. In addition to the fact that we know we need to get SSA more funding, what else can we do as Alliance members to our friends, family, about services and the like that SSA offers to the American public?
Misinformation, myths, and scams involving Social Security are prevalent. Fraud and scams targeting the elderly continue to be a huge problem. You can help us by pointing people to our official website to receive accurate information, including how to avoid being the victim of a scam and how to report a scam. We've redesigned our website to make it more user-friendly. At the top of our homepage, there is a link and it says, "What should I do if I get a call claiming there's a problem with my Social Security number or account?" People can click on this link to report a problem, see current scam alerts, and learn the basic signs of a scam. Here are a few things to remember and share with friends and family. Social Security, the Social Security Administration, will never threaten arrest or legal action if someone does not immediately send payment. We will not promise to increase a person's benefits or resolve identity theft issues for a fee or by moving money into a protected account. We will not require payment for a retail gift with a retail gift card or a prepaid debit card or cryptocurrency or wire transfer or internet currency or by mailing cash. And we will never text or email messages that contain personal information. Getting the word out is the best way to protect everyone. Besides getting the word out to help people protect themselves from scams, we also want people to know when they may be eligible for Social Security benefits. And our website contains resources to help inform your communities about benefits for which they may be eligible.
Thank you. As you know, in this age of computers and sophistications, the scammers are always thinking of new ways. And that's great advice to all of us, regardless of age, to let your family know. SSA's website up at the top. You used to say, if it sounds suspicious, it probably is. And that's very important for all of us to be aware and ask questions. Speaking of asking questions, our first poll on how many of you, and have you ever visited a Social Security office? Well, 82% of our respondents, acting commissioners, said yes, in their lifetime, they have visited a Social Security office. So just again, showing the importance of a local office with local staff, very well trained to answer questions that sometimes you need the personal interaction to do. So again, congratulations on having an agency that's up front. As again, we at the Alliance support the administration's request, as we always have, for increased funding. So we know we live in a country where 10,000 people are turning 65 every day. So the importance of Social Security and Medicare, because people have to go to the SSA offices to start their Medicare process if they don't do it online, is very important, as well as with SSDI too. So we want to thank you for being here. Wish you the best for Older Americans Month, and we're here to help and support, and please call on us as you see fit.
Thank you so much. It was a pleasure to join you. Take care.